One day, several years ago, Juliet Wittman, a journalist living in Boulder, Colorado, discovered a lump in her breast, which was subsequently diagnosed as breast cancer. In the latter parts of her treatment, she wrote this book, A Breast Cancer Journal. It has a lot of very important statistics in it.
And what led you to write this book? I mean, it's a deep personal event and one that's hit, I guess, millions of women in our country and throughout the world. And when did you find out that you had breast cancer?
Well, I just happened to be sitting in my living room one Sunday morning reading the newspaper and drinking coffee. It was sort of a pleasant, idyllic morning. I had my robe on, and for no particular reason, I certainly wasn't examining myself as one is supposed to do. I just touched a place on my breast, and I thought, is that a lump? And then I think I asked my husband if he thought it was a lump. I spent a certain amount of time basically denying it and sort of pushed it to the back of my mind, pretended I hadn't found it. I thought, well, maybe I'm premenstrual, maybe it's something like that. People's breasts change all the time over the course of the month. I'll just sort of leave it alone. And a couple of weeks later, I was in the shower one morning, and I felt it again. And this time I realized, no, this really is something different. This is something I haven't felt before. And I got hysterical.
Just if I can interrupt you for a moment.
Sure.
You had not been practicing breast examination.
No.
You'd heard about it.
Yes, and I knew it was something I was supposed to do, but I'd never given it any thought, really. I didn't expect to get breast cancer. My parents had both, in fact, died of cancer, but my mother hadn't had breast cancer. It just wasn't a big part of my world.
So you thought that these breast examinations and stories you'd heard, and had you had other women friends who'd had breast cancer?
You know, that's the odd thing. I think at that time, I either hadn't, or if I had, I didn't know about it. After I was diagnosed, of course, I met all kinds of women that it turned out everyone had had it. I mean, people would come up to me and say, my sister, my mother, my aunt, my co-worker. But I think at the time, I just was not particularly conscious of it.
And so this suddenly became something, were you in denial? You were in denial.
Well, I said I was in denial for about 2 weeks, and then I realized there was a problem and promptly got hysterical, but I did call up and get a mammogram, schedule a mammogram and a visit with my doctor, who thought it was probably nothing, probably just fibrocystic, but he said, well, I'm glad you signed up for a mammogram.
And what happened?
After the mammogram, I was very reassured when he'd spoken to me. I said, okay, it's just fibrocystic, and I went home, and the next day I had to go in to get the mammogram, and for some reason I got very edgy and upset all over again, and I really don't know if I had a premonition that something was seriously wrong or whether it was just getting the mammogram, but I got it on a Friday, and I spent the entire weekend worrying about it. And on Monday morning, I had the most awful fight with my boss. I mean, I think it was just right on the edge. And I kept trying to call my doctor to ask him how the mammogram had turned out, and I didn't reach him till after lunch. I think it was about 1 or 2. And he got on the phone, and well, actually, the nurse got on the phone. And what the nurse is supposed to say is, everything's fine, Juliet, see you next year. But she said, well, I'll let you talk to the doctor. Those are the words you don't want to hear. And he came on and he said, well, we've looked at your mammogram. We see a discrete cluster of calcification. This could indicate a tumor, and the radiologist is adamant that this should be biopsied.
Now, I noticed that you have an accent when you said the word schedule.
Oh, right.
It's because you were
Comes and goes.
You were born in England.
Right.
And when did you come to the States?
When I was 17.
And when did you come to Boulder?
I came to Boulder, I think I was 30 or 31. No, excuse me, I was 29.
And you married in Boulder, or you were
Right.
married? You have a child?
I have a daughter.
And you were living a very nice life of a Boulderite?
A very pleasant life. Yeah, my daughter was 10 at the time.
And you had a job that you liked?
I liked my job.
As a writer?
Yeah.
And suddenly you found yourself a statistic.
Right.
One of the, what is it, 1 in 9 now?
I think they say it's 1 in 8.
1 in 8 women in the United States, is that it?
Will get breast cancer.
Will get breast cancer.
Yeah. I think they diagnose about 180,000 a year, and they say something like 44,000 women a year die of breast cancer.
Now, as a journalist, as a writer, you found yourself in a situation where you had an ability to describe your situation, what you went through, but when did you decide to do this? When did you decide to write about what was happening to you?
Well, it was not right away. I was actually trying to write a novel at the time. I didn't want to write about this. I remember one of my co-workers at the paper saying, well, of course you'll write about this. Because, you know, journalists always seem to write everything that happens to them. You know, I went skiing, I fell down, my husband said lessons. I mean, I'm talking about those sort of personal columns and things. And I just got very indignant, and I said, well, no, that's vulgar. I'm not going to write about it. And then I was almost through with treatment. I was about 10 months into this journey. And I wrote an article for this Sunday. We had a Sunday magazine then at the Camera. And the response to that article was just tremendous. I mean, I had been a journalist for many, many years, and I'd written about a lot of interesting and controversial things. I'd never gotten so much mail, so many phone calls, and I mean, women calling up and thanking me. And one woman I ran into at the supermarket put her arms around me and said, thank you for telling our story. And then she said she'd shown it to her husband because he needed to understand how she was feeling.
And so this article that you wrote in the local newspaper and the very unexpected to you response that you got from it led you to begin writing a book about your situation.
Well, that was one of the reasons, yeah. I thought, well, obviously there's a need for this. And also, I think the kind of book I was looking for, I mean, the first thing I usually do when I get into a new situation is look for a book about it. And I think, you know, that's what I did. And I went and looked on the shelves to see what was there. And there was some sort of little how-to books like, when should I tell my boss I have cancer? Question, answer, whatever. And there were lots of books coming out around that time about, well, I got cancer, but I meditated and I ate carrots and I thought myself better and I did visualization and now I'm fine. And these authors always wrote as if they sort of knew at the beginning of the journey what the end was going to be. I mean, they were perfectly confident from the moment of diagnosis. And I didn't feel like that. I felt confused. I felt crazy. I had crying jags. I was feverishly laughing. I was irritated. I was lots of things, but I definitely thought I was crazy. And I wanted to know that there was someone else out there that had felt what I was feeling. I didn't find that. So I thought, well, I'm going to write about it. Oh, and I think another thing that motivated me, I was very lucky in one sense because someone connected me to a woman called Doris, and she called me right after I found out about the bad mammogram, and she had had a double mastectomy 3 months earlier, and she was alive, and she had gotten through it all, and she just sort of talked to me, and she said things like, well, of course you're feeling crazy, and everybody feels crazy. I'm going, really, it's okay? And then she would call about once a week, and she would say, well, this is how this feels. This is how surgery feels. I didn't have a mastectomy, by the way. After surgery, you won't be able to lift your arm all the way up. You'll be able to get it about, well, here. She'd say, you can play the piano, you can write, but you can't brush your hair. And it was just such a relief. And then I thought, well, not everyone has Doris, but maybe my book can have some of that function for other people.
So you wrote this because you felt a lack in your own situation of having someone else's point of view who had gone through this, and you thought that you could, by sharing this with the readers, perhaps help other people.
That was certainly my, you know, we all have a lot of motivations for the things we do, and I think that was my primary and most conscious motivation. I think I started to realize as I went along, because it took a couple of years to write this book, that another thing I was doing was putting myself back together again. I mean, you just feel so, how can I say, splintered, so in pieces. And then it's a way of sort of figuring out, well, you take this experience, which has been a very chaotic experience, and you say to yourself, if I can make something shapely and structured and reasonable and even pleasing out of this experience, then on that level I've conquered it.
Now, you're talking about the possibility of your own, at least possible, well, disfigurement, possibly death in the not too far distant future. It must take a lot of courage to speak about it, much less to write about it, to write a book. What was it like?
I think it takes a lot of courage to look at it, and most people don't. Most people live as if they were going to live forever. And I think the one thing about getting a cancer diagnosis, and thank God I did not get a diagnosis that I was terminal, that's sort of a few steps further along, but at that point you really have to stop and think, well, it could happen, and it not in some lovely distant, future, but maybe within a few months, maybe within a year. You get to where you're afraid to say, you don't want to say things like, well, on my next birthday I'll do thus and such. Or, honey, for Christmas I'll get you so-and-so.
Because you may not have it.
You may not be there, right. And you have to you do start living very intensely in the present. Very much in the moment. And I must say, I don't know, I've been reading a lot about death and dying lately because everyone's talking about the right to do it with dignity and so on. And we only have a few ways we allow ourselves to talk about death. But one is control. We must have control. We must figure a way so we can be sure when we're in extremis we'll be in control. Well, by definition, you're not in control if you're dying. You're in dissolution. And it's a very hard thing to look at.
But you had a family your family supported you.
Yeah, my family was terrific.
Can we talk about that? You mentioned it in the book. You deal with it at length.
One thing that's sort of happening, because a lot of women are getting breast cancer younger, is that children are being involved. Not just adult children, but in my case, a 10-year-old. And it was very difficult talking to Anna.
That's your daughter?
Yes, it was very difficult. When I was in this state of sort of fear and confusion, and I'm the one that's supposed to comfort her, but now I'm the one that's frightening her, and I can't make it better. I can't make it go away. And there was a period at the beginning, I think, where we were kind of tiptoeing around each other, because she's a very sensitive and thoughtful kind of girl. And at some point she came to me and said, I can't stand it when you won't talk to me. I'd rather know what's really happening, even if it's bad, even if it's scary, than just sit here and think about what it might be. So I thought it was pretty impressive for a 10-year-old, actually, to be able to articulate that.
You shared with her?
After that, I did, yeah. But still, it was interesting, like for a long time, she never cried. I never saw her crying. And sometimes she'd get a little cool with me, a little sort of standoffish. One day I picked her up, she takes ballet classes, so I picked her up after class and we were driving home, and I forget what happened, but she seemed a bit down. I asked her, did she want to talk? No. Would she like to talk to Daddy then? No. Did she need to talk about my cancer with maybe some of our friends, or would she like to see a therapist? No. Really flat, almost hostile, And then all of a sudden she turned around and she said, what was it? She felt guilty. She felt it was her fault. She'd done something wrong. I don't know if you remember, there were 3 whales trapped for a while in Alaska or something, and these Russian ships were trying to free them, and one of the whales died. Well, she thought it was her fault because she forgot to pray for that whale that night. So how these kids, they get into this magical thinking. So somewhere there was something like that going on. It was her fault. She should have supported me or been a more wonderful child, and then I couldn't get sick.
You had a lumpectomy. What did it reveal?
Basically, when they do a biopsy, and that is they took out the lump. It was that kind of biopsy. So that really was the lumpectomy. They had taken it out, but once they determined that it was cancer, they went back in. They took a little bit more tissue out so they could be sure of getting a clear margin, and they go under your arm and get all the lymph nodes they can find.
And what did they find?
Out of 32 lymph nodes, they found that one was cancerous.
And that meant?
What my surgeon said was that meant either everything was fine and I was clear, my body had dealt with anything that had gotten through, or something had gotten through that would show up at some point. I mean, that indicates spread to have any lymph nodes involved, but one is a lot better than, say, 10.
And that meant you had to go on to the next level of treatment?
I had to have chemotherapy then.
Tell us about that.
Well, it was 3 drugs, and it wasn't the most severe kind of chemo you can get, but it was not very pleasant. You go in, let's see, it was 2 weeks on, 2 weeks off, and it happened 6 times. So basically, in the fortnightly period that was on, I would go in on a Wednesday. I get these 2 drugs pushed into my vein.
Intravenous.
And there was another drug, a third, that I took by mouth every day. And then the next week the same thing would happen. Then I'd have 2 weeks off. And whenever I was off, I was just euphoric. It felt like I was on holiday, you know, because I wasn't feeling nauseated. I wasn't feeling tired.
Did you lose your hair?
I did. I lost my hair. And you talk about families and families being supportive. I think that was one of the, you know, you really do find out a lot about your partner when you're sort of up against the wall. And I do remember on chemo, especially towards the end, I started to feel just dragged out and miserable and incredibly ugly. I mean, I was sort of yellowish, and I had all these, you know, bald spots. And I mean, it didn't just go bald. I mean, I had nasty little sort of downy parts, sort of variegated map on my head or something.
Were you wearing a wig in public? Or?
I was wearing a wig in public, but I remember just standing there looking into the mirror, and my eyes looked bloodshot, and my skin was yellow, and my head looked awful, and I walked out of the kitchen. I was feeling so depressed, and my husband came up to me, and he just started running his hands over my head, and he was saying, "Isn't this wonderful? I've never felt your skull like this before."
Now, you went through chemo. Did you have to go to radiation therapy?
Yes.
How long
I had
did
radiation. That was 6 weeks, every day. And that's not as debilitating as chemotherapy, although I think the thing about radiation is it's frightening. You walk into this room, there's this huge machine, and it's pointing this ray at your breast. And all your life you've known that you should be afraid of radiation. When radiation kills people, it's bad, it causes cancer, but here they were deliberately
trying to kill off the cancer cells without killing you completely.
Right. And the whole room, the radiation room, is apparently encased in like a foot of concrete to protect the people of Boulder from this thing that's, you know, aimed right at my breast.
What would you consider the worst and the best reactions that you had from other people?
Everyone who's had cancer has bad stories about people that stopped being their friend, people that said outrageously stupid things. Like, I remember I told this gay friend of mine I had cancer, and he just sighed and said, "Oh, I'm going to another funeral Sunday. Seems like everybody's dying."
From AIDS?
And, yeah, AIDS in his life. And I remember this. People will tell you stories of grandpa or grandma or my aunt who died of cancer, and they like to tell you, they just get wrapped up in their stories, and they're not thinking about the fact that you're actually being treated for this disease. So they'll tell you morphine and pain, and he was in agony, he was screaming, and the skin was hanging on his arms, and he looked like a skeleton, and you're saying, shut up, shut up, shut up. But on the other hand, I want to say this happened. It does happen, but I can't tell you how wonderful other people were. I mean, from the guy that cuts my hair, and insisted that I look just splendid with this tiny little short gown. It's your little jock look, he said. to, you know, the women that drove me places when I couldn't drive myself, to, you know, my writer friend who just found a tape of music he thought would be soothing. And I mean, just little gifts and people calling and saying, I'm thinking about you. It made a big difference.
In the book, you deal also with the social effects of this. I mean, this is a phenomenon that is affecting a lot of people in our country. There's also a rising, I call it an epidemic of prostate cancer among men. I don't know what the statistics are, but I think they're approaching the breast cancer level among women. And we do not have socialized medicine or national health insurance or anything like that. Was it a severe burden on you and your family, the cost of the treatment?
No, I was very lucky. This was before managed care, and I had good insurance at the paper, and they even paid for me to see this magnificent Buddhist psychiatrist who...
A Buddhist psychiatrist?
Buddhist psychiatrist who... I still live by a lot of the precepts I heard or surmised from him. So, but I think there are two things we're talking about. One is the incidence of cancer. People are getting cancer younger. A lot of kinds of cancers are increasing. It used to be women didn't get breast cancer much before their 60s or 70s, then their 50s. I mean, several people mentioned this to me. The woman that gave me my wig, that sold me my wig, one of the techs at the radiation center. I was 46 when I was diagnosed. They said, we didn't used to see people your age. And then the wig lady said, the last woman I fitted was 26.
26?
Yeah.
And she was already suffering from breast cancer.
Right. And I think we have to look at environmental pollution for this.
What would your treatment have cost if you had not had health insurance?
You know, I don't know, but I presume thousands of dollars. I didn't have to spend a lot of time. I didn't spend any time in the hospital. But I think one of the things that's coming up for a lot of breast cancer patients is if it spreads, if it metastasizes, really the only treatment that they think has any efficacy is a bone marrow transplant. And a lot of insurance companies are refusing to pay for that. It costs over $100,000, I think.
Yeah, but I find the book to be very valuable. I've gone through the book, Breast Cancer Journal. Can we get a close-up of this book again? It's published by Fulcrum Press in Golden, Colorado.
Right.
And it's gotten excellent reviews. And also, it was nominated for a National Book Award.
Right.
Because you were born in England.
Right.
Even though it was nominated, and
right.
They said, well, you're not born in the United States, so you can't get the National Book Award.
Right.
But I think it's very, very important book, and I think that people should read the book. Now, is there anything that a message you'd like to get out to people, to the general, because a lot of people are going to be watching this show? How should people respond when people they know come down with breast cancer, or they get it themselves?
You know, I think the important thing when you know someone that has cancer is just to be there for that person, just to, you know, call up and say, I heard what happened, I'm really sorry, is there anything I can do? And then maybe not just leave it at that, because the person can be in such a fog of fear and confusion, she may not even hear what you said. She may not even remember that you called. So you call again a few days later. And I think you take your lead from the person about, does she want to talk about it? If she wants to talk about it, I'm afraid I'm going to die, don't shut her up. Don't say, oh, you won't die, let's talk about the weather. On the other hand, if she wants to deny it, that's fine too. That's her call. It's your place just to sort of be a receptacle, just to be there, and to say how much you care. Because I really believed, you know, I was telling you about the tape and my husband stroking my head and my daughter and all those things. I sort of had this image that there was this big scale, and here was death and here was life. And every card I got and every phone call and everyone that said, I love you, you know, I'm praying for you, that was like a little weight on the side of life.
So you feel it's very important to, if you know someone that has breast cancer, to reach out to them and
Absolutely.
to express your sympathy and friendship. This is a
Right.
message that's in your book.
Right.
And you have been in both positions now, both as a victim of this disease and someone. Have you reached out to other people? Have you related to other people?
I've talked to lots and lots of people. There was a whole period where when people were diagnosed, they would call me. And, you know, they just need to know that someone's there that's been through it, that's still breathing and living, that there's life on the other side of breast cancer. I went to visualization workshops. You know, people talk a lot about the mind-body connection and so on. And I guess I want to say that if trying to visualize yourself better and meditate and go to a low-fat diet and so on and so forth makes you feel happier and more in control of your life, then it's a very good thing to do. But the one thing I think is a negative is there is a kind of feeling in the New Age community, and you know Boulder is an intensely New Age kind of place, that we cause our illnesses because we need to learn from them or because we're imperfect in some way. And, you know, saints get sick. I mean, very realized and holy human beings get cancer. It is not your fault if you get cancer.
Is there any final thing you'd like to say, just out to the public about this?
Well, I think I've been reading a lot about these new AIDS drugs that a lot of people won't be able to afford. And most people in this country don't seem to care very deeply whether or not we have universal health care. But when you're ill and you think you might die, to know that there's something out there that will save your life, but you can't have it, only rich people can have it, I think that would be just about one of the most profound kinds of suffering I can imagine. And I think we have to have universal health care. We have to have universal coverage. It's hard being sick, but to be sick and not be able to get yourself treated, I think that's an obscenity.
I want to thank you for having written this book, Breast Cancer Journal, a very important book. And I'd like to recommend to everyone who sees this show to read this book, The Breast Cancer Journal by Juliet Wittman, published by Fulcrum in Golden, Colorado. Thank you very much.